likely the greatest peacetime challenge that the United Nations and its agencies have ever faced.
2,800 people have died from Ebola in West Africa since the first patient was diagnosed last December. The numbers increasing every day, the warnings more alarming every day. In a moment, our National Checkup panel with its say. Danielle Martin is one of our regular health contributors and is a physician with Women's College Hospital in Toronto. Tim Jagatic is a frontline physician with Doctors Without Borders, and Cameron Kahn deals with infectious diseases at St. Michael's Hospital in Toronto. Their thoughts in a moment. But first, some context. It's easy to understand why some say, what's the big deal? After all, it's a large world and the Ebola-infected part looks pretty tiny. That's it in red. And with 7 billion people on the planet, 2,800 deaths doesn't sound like that much. But listen to this.
This health crisis we face is unparalleled in modern times.
So let's go back to the map and take another look, close up this time. Patient 0 discovered here in Guinea 9 months ago. Since then, Ebola's been spreading, slowly at first, more rapidly now. From Guinea to Liberia to Sierra Leone to Nigeria to Senegal. The death rate for those suffering the illness is running at about 50%, and those numbers are starting to grow exponentially. Estimates say 5,800 are now infected. Some forecasts suggest that could grow to 1.4 million by January. With no end in sight to the spread, finally, last week, medical authorities got some heavy-duty help.
At the request of the Liberian government, we're going to establish a military command center in Liberia to support civilian efforts across the region.
Will that stop the dying? If not, what will? Does the world care enough about what's seen as Africa's problem? Ebola is crossing borders, but could it leap oceans? All good questions. Let's try for some answers. All right, well, a lot of alarming statements being tossed around about the seriousness of the situation right now. Greatest peacetime challenge ever faced by the UN, things like that. Tim, you've been in the area. You've been in Sierra Leone, Liberia, and Guinea. Does the rhetoric that we're hearing in terms of the alarm, does it meet the reality on the ground?
I think it gives us a really good idea of the level of the power that fear has to destabilize regions. The destabilization factor of the fear associated with this disease is what they're calling the alarm on. And I think it's very important for us as a community, as a global community, to really heed that call and really start getting our boots on the ground, because we can really, really put an end to this and restabilize all of these countries.
Danielle?
Yeah, I mean, it's interesting, you know, there's the medical aspect, which is really important, but as Tim's identified, you know, this is also about the ability of nations to respond, of public institutions to respond in times of crisis. And if you look at a country like Liberia, you know, profoundly destabilized by a decade and a half of civil war, trust levels are very low in the formal healthcare system. And so at a time like this, without sort of trying to build that public infrastructure up, you're looking at a potentially very serious situation, more destabilizing than the infection itself would suggest.
Cameron, when you hear those kind of numbers, it makes it sound like this is totally out of control.
Well, I think, you know, there's no question that this is a very significant health and a humanitarian and an economic issue, as well as potentially a security crisis. I think the challenge comes when we in Canada are looking at this event and we don't necessarily feel the magnitude and the impact of it. You know, we're told here that the disease perhaps is unlikely to show up in Canada, and if it did, that our healthcare system would be able to respond to it. So I think, you know, many are facing a bit of this mixed message of a global emergency, but yet probably not going to have significant implications.
Well, you know, you take that and you start to look at the containment issue there. And you wonder, like, why is it taking them so long to deal with this? It was clear within a couple of months that this was not an ordinary outbreak, that it was serious. Why couldn't it be contained?
Honestly, I just don't know. I've been trying to figure this out for myself, and I do not know. I don't know.
Anybody know?
Well, I mean, of course, I don't think there's a single answer to the issue, but I do think that, again, this is a question of the ability of institutions to respond in a time of crisis. So, you know, we say that if there were to be an outbreak in North America or a case in North America, the healthcare system would respond, and that's true, but so would the public health system, so would the security system, so would all of the other systems that we have in place to protect communities. And when those systems break down, it becomes more than just a medical issue, and I think that's a big part of the reason why it's been so difficult to contain this outbreak.
Comment?
Yeah, I think there's a couple of other issues, and what I see is a challenge of governance and a challenge of capacity. If we look at the World Health Organization and just listening to Margaret Chan's statement, this is a really big challenge for the United Nations. One of the issues is that the World Health Organization really sees itself as playing more of a supporting role for the management of infectious disease outbreaks. So that works well when you're dealing with a country that has significant capacity. We can see it doesn't work very well when you're dealing with countries that have very limited capacity. And the second component is that WHO has really experienced some pretty dramatic financial cuts in the last 5 years or so. Their annual operating budget is around $2 billion a year. And just for perspective, if we look at the US Centers for Disease Control, they have a $6 billion annual operating budget. So the World Health Organization has to look after all of the world's diseases, chronic and infectious, emerging and non-emerging, and it has limited capacity, I think, to really fill that role.
Just want to stop you there for a moment while we check in with Dr. Ahmed Tejan-C. He's an assistant professor of medicine at the University of North Carolina. He joins us tonight from Raleigh. You've been dealing with doctors on the ground in your home region of West Africa for the last couple of months on this issue. In the last couple of weeks, there's been a movement in terms of trying to move aid to Africa. But is the aid that's being moved, is it what's needed on the ground?
Well, the problem with this crisis is that it's always been a little too little, too late. In the last few weeks, UNICEF did deliver 40 tons of aid, which did include long-awaited ambulances, personal protective equipment, etc. However, despite that, 9 months into this crisis, there's still a shortage of personal protective equipment in all 3 countries. The problem with foreign aid has been often the donors really don't listen to what the recipients want.
And what do they want?
Well, they need more, definitely need more logistics in terms of ambulances, hearses. In many cases, ambulances are doubling up as hearses. In other words, infected Ebola corpse is taken to the cemetery, and that doubles up to pick up a suspected case for Ebola. And that suspected case may not have Ebola and ends up acquiring the disease due to the fact that he or she has been transported in an infected vehicle. So these are a lot of logistic issues that are on the ground that we're noticing, and personal protective equipment has led to a lot of healthcare workers being infected with the virus, unfortunately.
You know, a lot of people questioning whether or not Africa is facing this problem because the rest of the world deems it as an Africa problem. If this was happening somewhere else, the argument goes, it would have been contained and dealt with much quicker. Is where it's happening part of the problem here?
I'm afraid I have to agree with that. To be frank, the Ebola didn't really hit the global headlines until the 2 American aid workers were infected, Dr. Ken Brantley and Nancy Wrightball. Other than that, it was just kind of simmering in the back pages of most global newspapers. And the same situation happens, that bubbles up occasionally with the WHO making the public health emergency announcements, or they're saying that the announcement today where there's estimated probably 1.4 million people may be infected by January 2015, and then kind of simmers down again, whilst a lot of stuff is happening on the ground. So it definitely is seen as a problem of others rather than a problem of us as a global community, and that definitely needs to be corrected.
All right, Ahmed, thank you for your time, and thank you for joining us tonight from North Carolina. Is this an Africa problem? Is that part of the issue here, that people see it as, you know, it's a long way away, it's on another continent, and we don't face the problem?
That could very well be the situation. If it is, so be it. Whatever your thought process is, let it be your thought process. But the fact of the matter is, please help us in this outbreak. We need people on the ground. We need more boots on the ground. We need more equipment. With what we're doing right now, we can beat this virus. We just need more of the same. We need people manning these isolation wards. We need people going into outreach, and we need people to really just be there to make sure that we can contain this thing. So whatever they're thinking, whatever the reason was for the inaction, it has to stop now.
Now, how do you get those people? What are you talking about? Doctors, nurses, aid workers?
Everyone, yes. So we have logisticians, we have laboratory technicians, we have doctors, we have nurses, we have educators. So we have all of these groups of people. This is a holistic approach that we're taking because it's not only about bringing patients into our facilities, but it's also about trying to decrease the rates of infection onwards. So we have people going out into the villages, providing education, providing different types of materials. We're providing soap, gloves, masks, all these types of things to help them decrease these rates.
Is there a resistance to want to go to help? I mean, nobody wants to see a crisis like this unfold, but what Tim's outlining here is a need for a massive number of people to go to help. Is there a resistance to do that?
I mean, certainly this is a very deadly disease. There's no proven safe or effective vaccine or treatment. So, I mean, and with a mortality rate that's at least 50%, possibly higher, you know, there's no question that there are, you know, concerns about going into to be in the space. Clearly, I think Tim's point is that, you know, for the security of the rest of the world and in terms of its health interests, you know, we need to get this outbreak under control. The numbers that we've just heard out of the New England Journal of Medicine today, you know, we might be complacent today and say this is not going to be our issue. But if we let this continue to grow exponentially, it will move beyond a humanitarian issue and will become a direct national self-interest issue.
Well, talk about that in terms of the threat to Canadians, because we like to believe that it is isolated in one particular region of the world and it's not going to leap oceans. Should we be comfortable in that belief, Danielle?
Well, I don't think that fear for our own selves and our, you know, panic for the health of our own domestic citizens should be the driving issue here. You know, again, if it were to be the case that we were to have a case or even a small outbreak of Ebola in North America, the likelihood that that would be quickly contained and dealt with relatively effectively is extremely high. So I don't think that people need to be, you know, lying awake at night worrying that Ebola is going to come to our shores. That doesn't mean that there isn't an urgency to act.
But that is the issue, is it not?
Well, that's the
how do you
tension.
drive
Right.
that kind of energy that Tim's talking about? Because the fact is, most people do look at it that way. Is it going to be a problem here, or is it just a problem there?
Right.
And to drive the kind of action and reaction that Tim's talking about.
Right, and I think that the point, you know, the self-interest point that we are need to have some more, that needs to put pressure on us is less about worrying about particular cases of Ebola and more about, you know, can the United Nations as an institution weather this storm if it doesn't respond effectively and if we don't help it to do so? Can the World Health Organization weather this storm if it doesn't respond effectively? If we as a nation believe in these international institutions and believe that they have a role to play in our global community, then we need to support those efforts, because if you destabilize those, you destabilize, you know, the world. And so it's bigger than just the medical epidemic.
It must be so frustrating to you to listen to some of these kind of arguments play out, because you've been there on the ground, you're dealing with the patients right in front of you. What is that like? Tell me what that's like when you're dealing with that.
Well, I have to say, when you're with the patients, the first thing that you realize is it's a very anticlimactic situation. You're not dealing with this virus that people associate with hemorrhagic signs, with blood coming out of the eyes, nose, ears, some type of dramatic idea of what this is. You're seeing people with a fever, nausea, diarrhea, vomiting, the types of symptoms that you can associate with so many diseases. And when you see this, you realize we can do something about this. We really can. We can help these people. And when we started to intervene with these people, we found that we were able to take a disease which has a 90% mortality rate when nothing is done, and we brought it down to 50% with the most basic medical care. So that is such an encouraging sign. It's a very optimistic, I have an optimistic feel that we can really get this under control, because we're doing the most basic things right now. And if we can really increase our efforts, we can really, really put an end to this.
All right, we've got to take a quick break. But when we come back, more on that issue. The question, What should we know about Ebola that we probably don't know? Welcome back to our national checkup on Ebola. Dr. Danielle Martin, Dr. Tim Jagatic, and Dr. Cameron Khan are all at the table tonight. So let me play off a little more from what Tim was saying. We're trying to get an understanding for those of us who don't know anything about Ebola. What would surprise us about this disease? What do we not know about it?
You know, I think one of the important things about Ebola is that this is a disease, an infectious disease of animals. And I think one of the things that people don't necessarily recognize is that about 3/4 of all new infectious diseases we see in humans, from HIV to SARS to Middle East Respiratory Syndrome and now Ebola, have their origins in animals. And I think one of the really important things for us looking to the future is how we interact with animal populations is directly going to affect our own health and our security. You know, if we look at avian influenza, for example, that has a lot to do with the production of livestock and our consumption of food. In this case, this is contact through wildlife ecosystems. And so as we disrupt these different types of animal ecosystems, we are likely going to encounter infectious diseases that can adapt themselves to humans and have a broader impact. So I think this is something that we need to keep in mind as the bigger picture in this story.
Danielle?
One of the things that I find so striking about Ebola is that although it has a very high mortality rate, in fact, it's not so easy to contract. It's not a highly infectious disease. Really the primary way to get it is by directly sharing body fluids, which means that actually to contain the spread is actually pretty easy to do, and it comes back to no matter these so-called new, diseases that arise. It's actually pretty old-fashioned stuff that's required again and again. We need to wash our hands. We need to wear masks and gloves when we're interacting with people who are sick. We need to not have people crammed into overly crowded environments. Basic public health interventions that can save lives. And we seem to need to keep learning that lesson over and over again, from the Spanish flu in 1917 all the way to present day.
Tim, take me back to the personal side of this. Do you worry about your own personal situation when you go? You'll be going back in another month or so?
Yeah, well, the infection control that MSF has, I have a great deal of confidence in it. Of course, it's always a concern that we all have in the field, but at the same time, the measures that we take versus the risks that we're taking, it's definitely worth what we're doing.
But it seems like you're so emotionally involved in this as well. It must be at times, difficult to deal with your own personal safety.
It's always very important to kind of maintain the delicate balance between emotion and rationale. Always pay attention to your surroundings. Always make sure that when you're taking your personal protective equipment off, that you're doing it properly. Always just making sure that you're staying calm, that you're keeping yourself in a proper mental state so that you're able to get through this rather high-stress environment.
High stress, for sure. Thank you all, and good luck, Tim, on your trip back.
Thank you.
Thanks, Danielle, Cameron.